Well, in Gaza, the war has taken a devastating toll on Palestinian women and children. Hospitals are overwhelmed, and that means that many can't get basic care. The UN says at least 50,000 pregnant women are unable to access health services. 5,500 of them are expected to give birth this month, and it's unclear how they can reach hospitals through a war zone or get the care they need. Let's bring in Dominic. He is the United Nations Population Fund's representative for the state of Palestine. He joins us now from occupied East Jerusalem. Dominic, what facilities are actually available right now, and how long will they be able to keep functioning?
Well, thanks, Natalia. I think it's been a horrific week, and as your reports have shown, the unfolding humanitarian crisis in Gaza is truly catastrophic. There are around 1 million women and girls in Gaza, and UNFPA is extremely concerned, as you said, for the 50,000 pregnant women who right now cannot access basic maternity health services. And because of this, they face this double nightmare. And this is as part of a bigger challenge with the healthcare system. This is a healthcare system on the back of 16 years of a blockade. It's crippled, it's under attack and on the brink of collapse. And as you pointed to, these pregnant women have nowhere to go, and they're facing unthinkable challenges.
How has this evacuation order for northern Gaza affected things? Obviously, it sounds like heavily pregnant women have been forced to flee.
Yes, I mean, so our team is obviously, as part of the UN team, on the ground and trying to support as much as possible. But the stories we hear from testimonies from Gazan pregnant women gathered in the last few days are really shocking, very shocking. One pregnant woman said, and I would like to quote her, "I couldn't help but think how my baby was feeling with every explosion." And this is a pregnant woman from the north of Gaza, and who was shaking with every bombast. And amidst this, in this movement that she had to do over Friday morning and in the past few days, what we've seen and heard is also stories about where they felt that it was nowhere for them to go. The one really bone-chilling quote was from one 30-year-old pregnant woman who told us, "Each step feels like a race against death." One of those women, though, did say, as she's sitting in the shelter on a cold floor without basic food, hygiene, water, at the very bare minimum, she was saying every kick, and I want to quote her again, "Every quick kick from my unborn child was giving me hope and strength." So we're working as hard as we can to, as your previous report said, try and get those supplies into Gaza as soon as possible and support the healthcare facilities with which we work.
Of course. Dominic, what are the international law implications here? Are there legal obligations to protect these women and their babies?
Well, I mean, this is very clear, and the Secretary General has called for the respecting of international humanitarian law. Civilians and healthcare facilities are not a target, and we call for their protection. The violence has to end, the siege has to end, and humanitarian aid must be able to get through. And that is part of where not only the Gazan population, the 1 million women, but these 50,000 pregnant women, which I'm speaking of and UNFPA is deeply concerned about, they need to get access to those healthcare facilities. They need that humanitarian aid to get through. And all parties need to abide by international humanitarian law.
Dominic, you talked about trying to get aid into them. Is there a way or any kind of a plan to try to evacuate them, to get them out?
We're focused at the moment around this major challenge around Gaza running out of water, electricity, health supplies and other issues. So right now, the UN itself has stocks available of those items: food, water, medical supplies, fuel. It's located in Egypt, in Jordan, in the West Bank in Israel, and these goods are ready to be dispatched within hours. So our focus and our staff on the ground are working tirelessly across the UN system with our NGO partners to be ready to get those supplies across as soon as a humanitarian corridor can be negotiated and can then be delivered.
Dominic there, the UN Population Fund's representative for the state of Palestine. Thank you so much for joining us, Dominic, and we really wish you and the agency all the best with your work.
Thank you very much.